The new channel. The new channel. Hashtag TNC Now.
The views, opinions, and insights expressed in the following shows are those of the host, producers, guests, and viewers. They do not necessarily reflect the position of the channel. Viewer discretion is advised.
Hello and welcome to the new channel. Our passion transforms a community that sees all things new. I'm Nato Agbayani and I'm streaming from Quezon City. Good evening. Welcome to Para sa Bayan here on TNC. Good evening, ladies and gentlemen. We're here on Para sa Bayan. Tonight, we have a very special guest. Actually, he's my first cousin. His name is Dr. Benigno Agbayani. He has been in the public forums, as you may have known, on COVID-19 and other related public health issues. He has already been, he's also a strong advocate and vocal advocate of these issues, root cause medicine, fasting and low carb diet, banning of the sale of tobacco, corruption of science and medicine by big pharma, sports medicine, and exercise. Also, he has given 4 major lectures in the past 2 years. So we have that bias FDA DOH versus ivermectin use, very controversial, but very critical in the discussions about COVID-19. COVID-19 vaccines and coercion in the Philippines. Diba? And then, of course, he gave a lecture to the Philippine American Academy of Science and Engineering, and the UP School of Economics Alumni Association, and also focused protection instead of lockdowns in the pandemic. Of course, without any further ado, ladies and gentlemen, let's welcome our very special guest tonight, Dr. Benigno Iggy Agbayani Jr. So, welcome.
Hi. Good evening.
Good evening, Doc
Good
Iggy.
evening, Mr. Nato Agbayani.
Welcome to Para sa Bayan. So, Para sa Bayan is basically a show on public affairs. We discuss public issues like, the last time we did agriculture and then technology. It's really how to move the country forward. But before anything else, I'd like to ask you to give, in your own words, a little background about, your career journey since med school or since college, whatever. So please tell us more about your journey in the practice of medicine.
I graduated from the UP College of Medicine in 1991. Then I took up orthopedics at PGH, and I went overseas for 2 years to train more on orthopedics, and then I came back as a professor at the UP College of Medicine Department of Orthopedics, where I taught for 7 years at the Department of Orthopedics at PGH. But then I resigned because my practice was getting busier, and somewhere about 10 years ago, I noticed that there are things na naglalak sa aking my being a physician. So I thought that I
Mhm.
should also tell other people about what I'm learning outside of my school. So I wanted to share my awareness, and usually it started out in Facebook, and a
Mhm.
lot of friends now wanted me to talk about it. So I've learned so many things from friends, colleagues, and I do my research, of course. Armchair researcher, not really yung mga experiments, no?
Right.
But ano talaga, I came to realize that there are things that you must do independently of the
Mhm.
institutions of our government, and to think critically.
Yeah.
And so I find that I do tend to be considered a parang kontrabida or ano, but I think I'm just being sharing my role as an observer. Ganun lang
Yeah.
naman. So, but people find that as siyempre, kumukontra ka. So that's in my background, and hindi naman, I don't force myself onto other people, but I do get invited. I think they wanted
Right.
to see a second opinion or another point of view.
Yeah. Uh, Recently, you have been speaking in the public for about, well, of course, COVID-19. All throughout, I think during the pandemic, maraming issues that were raised, and Um, amongst them is yung use of ivermectin, use of course, also the kasi parang forced, 'di ba? Yung ating vaccination, and to the point that people are being how do you call it, prejudiced, no? Kasi there are ano, no, ang tawag nila doon, anti-vaxxers for good reason, I suppose, no? They have their reasons, and I know you have been very articulate about this. What are your quick thoughts? I mean, about those issues now that we're like almost, I don't know how many percent vaccinated. Still, no, there's that stigma na if you're not vaccinated, medyo teka, hindi ka pwede magtrabaho or stuff like that. What do you think about that?
Uh, there is a mistrust. I think
Mhm.
we have to understand that public health requires almost absolute trust. Kasi that's how governments behave, how the Philippine public has behaved. To trust the institutions.
Mhm.
Unfortunately nga, I think maybe beginning somewhere, I think yung mga landmark events was the Dengvaxa issue.
Yes.
So that is to me parang a landmark event. And then there was this syntaxes.
Hmm.
Those were events that happened before that may have something to do with what we're experiencing now. But
Right.
worldwide, this is not nothing really new. But again,
Hmm.
thanks to the internet, I mean, more than ano na tayo siguro, 12 years, many people are become active using the internet as a source of materials. It's
Hmm.
become easier to be knowledgeable, informed, so
Yes.
to speak. And hindi na tayo parang tatamad-tamad na bahala na ang Department of Health, bahala na si Senator ganyan o si whoever to
Hmm.
decide for us. So I think
Yeah.
through those things, I just don't complain naman. I do read more onto these things. I ask some experts. I discuss it with my colleagues and my fellow doctors. Then I come out in public. I give my opinion.
Mm. Yeah. 'Di ba isa lang 'tong COVID-19 but there are other public health issues like really access to basic health. And there's like 42,000 barangays all over the Philippines, and ideally there should be a barangay health center in each barangay maybe to get 'di ba, primary health care. But what do you think? Where are we lacking? Are people getting access to health? Parang I have a feeling, I mean, I'm not, this is just my opinion, that of course the vaccination thing was also fueled by the resources of big pharma. Pero itong questions like, the basic the very basic health issues of children, maternal health care, yung ganun ba? Child mortality. There's so many other issues other than, of course, COVID. Para bang, what do you think? Where are we lagging or where are we lacking in terms of providing healthcare for our people?
Kasi ang healthcare, even if you think of family,
Mhm.
it's a big, parang you deduct a lot from resources.
Mhm.
But siyempre, health is wealth. Pero from the point of view of the government, sometimes hindi nila priority. And I think, first of all, it's the prioritization of health as a
Mhm.
problem sa government and public health thing.
Yes.
The other problems follows, of course, yung even the way we train doctors and nurses, talaga may tendency talaga na would you would tend to leave the country rather than stay in the country. Because of course,
Mhm.
first of all, yung pay is bigger in other countries. And apparently it's a dream of many doctors to, first behave like a scientist of the world, but save humanity. So to them, it doesn't matter whether Philippines or world ang serve nila. But I think it boils down to, again, yung ating priorities. We tend to belittle the health issues.
Yeah. When you go to the provinces, I mean, this is really common. Or even here in Manila, people who come from the provinces and come here, uh, not for anything, basta coming from rural areas, they tend not to get a checkup or go to the doctor because they're afraid na, teka, pag nagpa-doktor ako, this is gonna cost money, I have to buy medicines and stuff like that. And it's ingrained into the Filipino psyche, especially of the rural poor and of course even the urban poor, na talagang
Correct.
parang it's a cost. It's a cost and titiisin ko na lang, magwa-water therapy na lang ako kaysa magpa-doktor ako, because it's gonna cost me money. I mean, maybe it's
Yeah.
it's a poverty mindset, but gano'n eh. I would rather
The
spend money on food rather than healthcare, 'di ba?
your observations are accurate talaga.
Yeah.
It costs. Well, just to give you as a parang microscopic view of things muna.
Mhm.
Then we go to the bigger things.
Yes.
To study medicine, you go through pre-med.
Mhm.
So you spend 4 years in college, and then 5 years of medical school, and then you are a general practitioner. You're not even a specialist or anything. So that's
Okay.
already 9 years. So
And you're
in
not
that
yet a
alone,
specialist.
oh, you can be a general practitioner, and then you of course have to take the exam. So 9 years will take a family that is has to be well-to-do to allow you to study 9 years without earning, while as your brother or sister who finishes a 4-year course can immediately earn.
Right.
So that shows you a problem sa medical field na kanon na it really hindi siya akma sa ating and I've
Mhm.
suggested to my friends in UP, for example, in the College of Medicine, that we should try to shorten the medical studies. And there is such thing as a 7-year course.
Mhm.
It's supposed to be an experiment, intermed, and we call it intermed because it's 7 years instead of the 9-year course. But it's an ongoing experiment for 35 years and so. So how come we
Mhm.
can't just make it that way, Pero yun nga, that's one. The nursing problem. You get paid a salary, starting salary around 30,000 pesos starting as a nurse.
Mhm.
So a nurse overseas somewhere around 300,000 pesos kung convert to sa dollars. Parang hindi talaga,
Ang
it
layo.
shouldn't really stay. It shouldn't really stay in
Yeah,
the Philippines.
that's right.
And then drugs, you go to the pharmaceuticals. We compare, our drugs are too much expensive compared to examples like India, who are able
Mhm.
to produce their own drugs, who are able to be more, say, savvy about it.
Yes.
And many other things na ano talaga na pwede natin sana gawin to make it more akin to what the Philippines would need.
Mhm.
And there's so many Department of Health secretaries that have come and gone. And I think they all have problems with dealing with bureaucracy, corruption.
Mhm.
And again, despite all the heart that some of the secretaries have gone through. And one of them was a classmate of my dad, your uncle,
Mhm.
si Secretary Flavier. He had all
Yes.
the heart and even the
Mhm.
brilliance, no? But kailangan talaga, ano eh, continuous eh. And you're only a secretary until the president, ano,
For one
changes and
term.
appoints another one.
Yes.
Nabuti pa
Correct.
si Fauci nga eh. Si Fauci has been there for the longest time. Talagang
Yes.
professionalized. But I'm not even emulating the US. One of the worst, I think, one of the worst, if not the top 10 worst health system of the US. We should not copy it. We tend to.
Yeah. Parang looking at it, no, there's a lot of things that well, you mentioned the education in terms of medical education. It's expensive. Only the affluent can really afford it. And then also in terms of infrastructure, I think my dad before used to do the rural health centers. He used to design it, but I was thinking, okay, yon sa rural health centers, but you also need personnel. So you need to tool people to man those, hindi lang administration. I mean, you really need doctors, nurses, paramedical workers, and stuff like that. And then you see the Cuban model, no? Na it's like at the household level, they're able to provide healthcare. And are we too many? Is the Philippines too huge to manage, or is the bureaucracy too, I don't want to say corrupt, but maybe that's the or it's too bloated? Parang how do we arrest these problems? I mean, where do we start? Dapat
Yeah.
mamaya pa yung discussion natin, ah.
You're
Pero
correct about
yeah.
Cuba, no? Kaya lang yun
Mm.
nga, we cannot really look at Cuba as something like the Philippines. Kasi, they are a well-controlled country.
Yeah.
Of course, they're a communist state. And there are things
Mhm.
you could really do in such places. And for one, hindi nga sila influenced by the United States. Like I said,
Yes.
big pharma influences how health is run in the Philippines, and no one is
Mhm.
going to admit that. But I know it's true. So there's that problem also. And if I say that, syempre, that's corruption. If big pharma influences the way our health
Mhm.
issues are being tackled in government, but it's not unique to the Philippines. I
Yeah.
think it was international Transparency International who made the paper back in 2014 saying that one of the most corrupt departments in the world is the health department. In the world, I'm
Mhm.
not talking of just the
In the
Philippines.
world.
Oo, kaya
Okay.
ano siya, and it's very unique. It's hard to catch corruption. Kasi those are scientists, those are doctors. How do you really, just accuse them of conniving? Kasi syempre, we still trust
Mhm.
our physicians, our health institutions. But they have
Yeah.
already said na malaki talaga ang corruption, and I'm very sure it affects the way our policies are made.
Yeah. I think it's the whole infrastructure, the commission, sorry, the commissions and everything, and also lobbying policy. So it's really, how do we call it? It's really been institutionalized. Now, um, moving forward into the next, I don't know, in the next 20, 30, 40, 50 years, we see that there's very little improvement in terms of really, um, eh, even, well, we're blessed in Quezon City. Each barangay has a an ambulance. Pero in the provinces, my goodness, even in clusters of barangays, there are no ambulances. Even in the far-flung barangays, there's really nothing. And kaya nga yung traditional medicine, 'di ba? It's really well in a way that could help. But of course that's there's so many things happening under the in the health
Yeah,
situation of Filipinos.
pagdating kasi, if you look at things like ambulance, mga services ng labs, x-rays, it boils down to the money. Of course,
Yeah.
local government that doesn't have money will not have budget to keep those things running.
Yeah.
So it really boils down to the money. But I think that's also prioritizing. Can central government really say na, okay, allot this much to your health budget? Yun lang, maybe we could do something about that. And
Yeah.
nandun naman eh. Like sa COVID, I think when government wanted to put money, they were able to put
They put
money.
money. Yeah.
Even without anyone asking.
Yeah.
Parang talagang automatic. Kasi I think
it was automatic.
Political points.
Yeah.
At the same time, was looking, baka may kickback or whatever. But
Yeah.
again,
I think policy-wise, I think 35% of the entire national budget was allocated to COVID response. So
which is
from
wrong.
which is like so you're left with 65% to run the bureaucracy, to run the government agencies on the national level, and even on the local level, 35% was automatically allotted to COVID response. So I mean, it's as if it was the
Which is
only
the budget, 35% of what budget?
35% of everything
The national budget?
during the pandemic.
You got the
I mean,
national budget.
national budget and even the local budget. So parang automatically
Just
and
imagine
a lot of it was realigned.
like 140 billion pesos. That's more than how many? More than the actual budget of the Department of Health for a
Exactly.
vaccine that has not been tested. I mean, nagalat sila. They were buying already even hindi pa na lumalabas yung studies. That's how bad the health system is. It just tells you something about policies of public government, public health pala. So that tells you something. Kasi it shouldn't be like that. You shouldn't be buying things like that without parang, I would say, good safety studies, good efficacy studies first. Matagal na these policies on health have been there for quite some time. Hindi naman bago ang WHO, hindi naman bago ang ating mga hospital systems. They were there because they didn't want things like this to happen. But there are things that, they manipulated our crisis response. That's how they got away with it.
Grabe, no? I mean, I don't know where to start, Doc Iggy, no? How can you
How about
prepare?
good things? There are good things naman to discuss then.
Yeah, I mean, how can you repair something this systemic, Parang, I mean, maybe we can discuss the good things.
I know.
What would you say are the good things so far?
There are things that we can do.
Yes.
That will matter, and it won't really cost us so much.
Mm-hmm.
And I will just run through some of them, but each of these things are actually big topics in themselves.
Mm-hmm.
If you stop smoking, for example, in the Philippines, just pretty stop it. How many billions of pesos would we save in terms of health? Mm-hmm. We save so many kasi wala na magkakasakit from smoking-related problems.
Mm-hmm.
But you can't really just say stop it. But if we can, it would save money. If, for example, we just say sugar is, bad.
Mm-hmm.
Just make that as a policy, or really put out all the advertisements, all the promotions, or saying how bad sugar is to our health, as much as they did for COVID. That would have saved another billions of pesos of diabetes expenses, dialysis, heart disease. It's just there. It's just there. Kailangan lang talaga tutukan.
Structural, ano?
Let's talk about promotion of exercise. That's another big thing. Pero the way it's being promoted kasi, iba yung style ng promotion ng exercise natin eh. Hardly part of the big picture eh. You can see a few people saying this, saying that, pero hindi rin naintindihan ng mga tao, ba't pa ako mag-exercise? May trabaho naman ako, pagod ako, etc. Ano pa ba pwede natin, mga big topics eh. Certainly, nandyan na nga yung infection and management of crisis. Nandyan talaga yan. Pero yun nga, I think we believe in experts that should not have been believed. For example, in that problem. Because if I were to ask for example, my school, if you have a pandemic, and we could get the experts, what kind of expert would you ask?
Yeah.
You would ask the public health specialists. You would ask the epidemiologists. They are really the person. But go ahead. Can you look for a public health specialist talking about COVID-19 in the Philippines? You can't. Wala eh. There are, pero they're not being asked. They're not the ones advising government because they would have a different take on things. And we doctors know that. Or the people at the department do not know that. Yes, you can ask the infectious disease, pero infectious disease kasi, specialist, for example, our expert that we listen to is an expert in HIV. Another one is an expert in mga tuberculosis. Yes. But when a new pandemic arrives, it's the one that has experience in the Philippines. We're the public health doctors.
Yeah.
And they are connected to, they have experience. I will not mention his name. But when I ask him, why doesn't he become more vocal about it? And then I ask what else he is doing. He's actually hired by the WHO. So may conflict ng konti sa akin niya kasi how can you be part of the WHO and the Department of Health? Parang dalawang amo mo eh.
Yeah.
We cannot be just following the WHO, although some people say that, parang yun ang yun ang ating among Catholics, syempre, parang Vatican. No? But that's not true in science. In science, it's open discussion. No one is an absolutely right thing. There are experts, but in public health, for example, you want some kind of saying na, okay, we have discussed among all our scientists here who are open-minded, who are not suppressed, to come out with a public health policy. Which, where was that?
Yeah.
Hindi mo nakikita yun. There is no such thing.
Correct.
Unlike in Sweden, when they were asked, how come you did this and so many people died in the nursing home in COVID-19, tinanong yung Department of Health ng Sweden, we made a mistake. Sinabi niya gano'n. That's how candid they are and so honest that they should have really concentrated on protecting the elderly. And when he said, how did you come out with these new strategies? It was discussed among more than 100 scientists within their group. Which hindi rin naman parang sa kanila strange kasi they had a plan. These pandemics are not parang unpredictable.
Correct.
They were expected to arrive.
Yeah.
And may plan naman. And then something else changed. We followed a plan hoisted upon by the people from China, because apparently they should have been the first and would have known. But their pandemic response is, to me, has caused more problems. And there's proof now that the lockdowns have hurt our health, our economy, and overall, probably not helpful at all.
Yeah. Okay. So, Iggy, Doc Iggy, no? We will just take a short break. I'd just like to shout out sa isa nating viewer, si Cayenne Persona. So she's saying, good evening, Doc Iggy. Sana hindi magsabay ang oras ng programa nyo sa CDC. Salamat.
Tapos na.
So anyway, we'll go right into a short break, Doc Iggy, and then we'll come back. Ang dami na nating na-discuss earlier. So we'll be back sa lahat ng viewers natin. See you in a while. Doc Iggy, we'll be right back.
Juan Lu and his puppets face to face with special guests Makata Tawanan, Jess Box, and the Lunaria Marionette Show.
Salita. Alam mo, Tito Anlo, kung wala ako, nagsasalita ka nag-isa. Kung wala ako, wala kang masusuot. Kung wala ako, wala kang nakakain.
November 13, Sunday, 7 p.m. at the La Verdad Auditorium in Apalit, Pampanga. Buy your tickets now and see you soon, face to face.
Good evening. You're still watching Para sa Bayan here on the new channel. So please watch all our other shows. The new channel is an online alternative new media platform of online shows for people on the go. Please watch all our shows as seen on the screen. Imagine having your own show, your own playlist, your own content, but we make it easier for you. TNC aims to transform the lives of our viewers through engaging, authentic, and original content. Our channel is a responsible global 24/7 platform that showcases the Filipino talent, global influencers, cultural intelligence, and ingenuity. So, also, you can watch us live or replay via Facebook or YouTube. Follow us on IG. Listen to us on Spotify and Apple Podcast. Just search hashtag TNC Now. Also, for sponsorships, please email now@newchannel.com or send us a DM. Enjoy these life-changing shows because we made them all for you. So, thank you. We're back on the new channel here on Para sa Bayan. Let's bring back our guest, our special guest, Dr. Benigno Iggy Agbayani Jr. So, good evening once again, Doc Iggy. So kanina we were able to discuss a whole lot, no? A little about your journey as a physician, also your alternate journey of uh,
Public
finding
health
out new,
awareness.
no, public health awareness, etc. And then we also discussed the different issues, and then also the possible simple and hindi masyadong costly na solutions like anti-tobacco campaign, also the sugar. There's like billions and billions of pesos that could be
Save.
saved, no? Or
Yeah.
from these
So
efforts.
we have
So
to-
I'd like to continue on that, no. For example, tobacco. 'Di ba, sin taxes, I think you were also an advocate of the sin taxes.
No,
When
I'm
we
against. I'm against
you're
the
against
syntax.
sin taxes? You're totally against the use.
Well, I wouldn't use the word totally, pero I'm against it.
Pero when you say like if we are to like promote a policy or legislate something na would end or probably phase out the use of tobacco or sugar,
Which the
how do you think
syntaxes does not want to. The
sin
syntaxes did
taxes
not
wants
want
to
to continue it but pay higher taxes.
pay higher taxes? So parang those taxes can be used to also for
And there's
healthcare.
something wrong. There's something wrong. It rewards the government.
Parang ano, no? O sige, taasan natin ang taxes. Tapos babalik mo sa gobyerno, tapos yung gobyerno gagastos uli sa pag re-repair ng mga tao may
Yes,
sakit
yes.
na
And
sa
then
baga.
it doesn't make sense eh. Parang,
Yeah.
alam mo, papatayin ko yung ano mo, pero ito, may pera para sa kabaong nila.
Tama, di ba?
And yet, to
That's
me, that's so
precisely it.
obvious. I'm talking to experts, my professors, some of our friends. They don't get it. I don't understand why they don't get it. It's so simple to see.
Mhm.
Ewan ko, you are, as a layman, I just told you a simple example.
Yes.
I'm causing the death of your families, but don't worry, because of the taxes, we will pay for their coffins.
Di ba?
Parang ganun eh. Doesn't
Simple
really make
analogy.
sense. And then as physicians, yung mga ganyan trabaho ng politician yan eh. When you ask me as a doctor, my advice cannot be to deal with taxes. I'm not a politician. The experts, the doctors should say it's a bad thing. Why even bother dealing with them? Kaya dapat ang position ng doctors. But if you want to deal with them, huwag nyo na kami idami dyan. Basta sinasabi namin, it's killing people, it's causing cancer, heart disease, so many lung disease. So that's our position. Stop it.
Oh, yun pa lang you solve the top. Yun pa lang you solve the top killers eh.
Yeah, in fact, one of the most published scientists even said that, you know what? If you stop smoking, you probably would have caused less deaths sa COVID-19. And this is the most published scientist. His name is he's a Greek origin from California, but he's one of the most published scientists. Professor Anidas said that. Ako naman, I was saying that if you give vitamin D, how much it would have helped a lot of people. Fight COVID-19.
Vitamin D, right?
Yeah, fight COVID-19, help with respiratory illnesses, improve our immune system. prevent osteoporotic fractures, so many things. And, kung promote nila as much as they promoted vaccines, we could have stopped so many diseases as well, including COVID-19. They are now seeing randomized controlled trials and studies that show people with higher vitamin D are able to fight off COVID-19 much better. These are RCTs, or randomized controlled trials.
Right. Sige, I understand, no? I mean, come to think of it, all those billions of pesos we could save by simply doing things like that, no? Let's go to sugar. This is common. I have it. My relatives have it.
Yeah, yeah.
So what if we regulate and educate people about well, sugar is really a poison, right?
Yeah.
In effect, it's a legal poison. Yeah.
Ganito,
Mm.
the doctors have begun to say that we should have a limit of number of sugars or amount of sugars that a person can eat in a day.
Yeah.
This came out, I think, somewhere 2015. And
Mhm.
it's still there. And it's actually getting more media mileage. Pero media mileage requires money.
Right.
You receive.
Mhm.
And sugar is a big industry. You get my point. Hindi siya,
Mm.
it's there, the advice is there, but there's no impetus for the Department of Health to spend money
To stop.
on, to say
Right.
that, okay, here is what the Diabetes Society is saying. Let's stop this. Can I ask the government, the politicians, to find out ways to get it going, like they're doing, di ba? They're asking,
Yeah.
for example, sa mask. They made mask mandatory.
Mhm.
They prevented you from going inside buildings without a mask. So why can't they do that for something that would save thousands of lives, billions of pesos in public health money? But
Yeah.
yun na nga, kasi nga, may industry that's blocking it. And,
Yeah, it's a
and
whole value chain, eh.
something similar is happening to COVID-19. And we can talk
Yeah.
about that as another big topic if you want.
Yeah. I mean, sugar alone, like the whole value chain of dialysis machines, dialysis centers, metformin,
Okay,
and all
for
the.
example, let's talk about dialysis. Do you know that you cannot actually buy a kidney to have a kidney transplant? My father died, as you know, he had
Yes.
kidney cancer. And, people are saying magpa-kidney transplant ka, but he said he's too old, he doesn't want another person to suffer. It is
Yes.
true, but in fact, it is helpful to give a kidney. It will save thousands of pesos.
Mhm.
But we have banned it. We have made a law saying you cannot sell your kidney.
You
Anong
cannot
effect?
sell your kidney.
Effect
Mhm.
is hard to find someone who would give it. And wala. Suddenly you have dialysis centers all over the Philippines.
It's
There
like
is a block.
symbiotic, no?
May block tuloy na sinasabi, tama yung law na yan. Dapat talaga bawal ang kidney transplant. And these are voices coming from people who profit. Unfortunately, ganun talaga ang reality.
So right now, you can only get a kidney if it's donated.
Yes.
Is that right? You cannot
Yes.
purchase because dinimonize nila yung yung mga nagbebenta ng mga organ
Yes.
na
Sabi nila, it's parang abuse of people who give their kidneys. They will show examples na nagbayad ng 20,000 for their one kidney. Siyempre parang ang sakit panoorin na
may horror
ng,
stories pa eh.
true, but
Pinatay, gano'n, kinidnap.
there is another way to do it. Put
Yeah.
in law that a patient who will sell the kidney must have the following payments. Must receive health insurance, must be at least paid this much. Yun dapat ang ginawa, hindi yung ban the sale and let it be harder for kidney. So these are little things and nuances
Yes,
na
yes.
hard for me to defend. I would be parang may backlash yan sa akin. Si Dr. Agbayani. Walang pakialam sa mga inabuso ng mga kidnapper, etc. But that's not
Oo.
true. And each of these topics, smoking, sugar, meron niyang kalaban parati. And politics is part of that. How do you play with these tobacco companies? What can we get? Can we get more taxes from them? So, ganun rin. These kidney transplants, public perception is masama na magbebenta ng kidney. Ano pa ba? Let's talk about even circumcision.
Yeah.
You know that there is no evidence that circumcision is actually healthy, except for one study in Africa na very healthy and things like that. And yet, we allow the fact that there are people who get infected from circumcision, children.
Right.
So, ganun. These things are parang may socio-political aspects and cultural aspects that should be discussed.
It's like I get what you're saying, that there are certain, of course, we don't want to call it conspiracy theories, but the reality is that simple solutions, like for example regulating the use of sugar, strongly regulating the use of tobacco, for example, is going to save this government and save our people a lot more money that could have been put into more like I said, primary health care, mga barangay health centers, barangay health workers, para medical workers, 'di ba? Parang
let's talk about yung primary health care. That's a very important thing.
yes.
In
Okay.
2020, when the COVID was para wala pang solution, and there was some success already in some countries like Germany, for example, they were saying, we are doing well because we have a great primary health care system. And they were right. Because they were able to study it, they were able to manage it well. That was soon as after. But, syempre, you cannot suddenly start a primary healthcare system in the Philippines.
Right.
You need training, you need people, you need, But, there you go. We have been sleeping on this problem for a long time. It is not new. Primary health care in the Philippines kasi is preventive. That should also be tackled, yung diabetes, sugar intake, etc. under the primary health care system. Pero weak nga. But who really loves prevention? Tell me, can you make money out of prevention? Government saves, but there's a group of people who won't make money if you prevent lung cancer, if you prevent diabetes, and we should be aware of them, and we should actually warn them that we are aware of you.
Yeah, I mean, come to think of it, no, I think institutions like CDC, no, yung concerned doctors and the organization of the Philippines. These are your advocacies, right?
Yes.
So far. So it's the first time I've heard you speak on those things. Sayang, no? Maybe like in the future we can discuss it separately, and yet the impact is so huge. And you're right, because the public relations infrastructure of people who are profiting from this is really so strong and so huge. Yun yung no, parang indirectly, Doc Iggy, no, they're also responsible for the deaths of those people who have been,
You are
at the end of the
absolutely
day.
right.
Yeah, there's a moral responsibility na there's so many Filipinos who have died because of this.
Can I tell you a story, Nato?
Sure.
In 2020, around, I think it was August, so kakaumpisa pa lang ng COVID, I already saw a scientist claim that these lockdowns are bad. These lockdowns are wrong. You should not prevent people from traveling kasi nandun na kumalat na raw. He
Mm.
was saying, stop it, don't copy China. So I read him and then I did some research. I really thought he's correct. Tama. I think he's right. The natural patterns of pandemics really rise and fall. So we shouldn't do this coercion, uh, yung mga ginawa natin to stop people from working, etc. Which has cost
Mm.
billions of pesos and lives as well. And now, and those things were promoted, yung mga lockdowns na yun by DOH, and some of the experts are still here today.
Yeah.
But recently, I've heard that one doctor who was saying he'd like to say that he was wrong. Even Fauci is now saying he was wrong.
Yeah.
But you are right; they have cost lives.
Yes.
But look,
So many.
I was saying on a program, a radio program, we should rethink this COVID in 2020. 2 years ago, that
Mm.
lockdowns don't work because there were published papers and even talks about that thing. I even spoke to a alumni of economists,
Mm-mm.
the UP. I spoke about the topic in November 2020 that we should not do lockdowns because there's evidence now showing that lockdowns is hurting the world. The children, what we call it, the WHO connected, yung UNICEF,
Yes.
give a prediction that lockdowns would have caused millions of deaths among children because of the economic effect of the lockdowns. They were the ones who said that, and I think it became true.
And then I don't know. I mean, this is maybe not scientific, but the mental health,
Yeah,
mental
yeah,
health
it is
problems
scientific.
of the young
It is
people,
scientific.
even not just the young people, even us. Grumabe, di
Talaga.
ba? Yeah.
People think ganun lang kasimple, but public health and epidemiologists, scientists, know this. And
Yeah.
because they know it, they should be guilty of not acting on it. And because
Yeah.
I knew it, I made it a point to go public about it. I really did my best to inform everyone that lockdowns don't work. I spoke to a IATF person telling him, can you tell this information to the IATF? So daw umabot po sa DOH. We wanted an appointment with Duterte, but we couldn't get a chance to speak with Duterte.
Yeah.
But now, looking back, I really see it as part of a bigger plan. Kaya talagang no one would really want to listen to us. It's part of a bigger plan. So they call me a conspiracy theorist. But
Yeah.
hey, I have the studies now which show that I was right and you
Yeah.
were wrong. Harvard
Right.
just came out publishing a paper about it. That lockdowns have cost us more than the
Benefits.
pandemic itself.
Yeah. Grabe, no?
So
And
where are the apologies? Where are the apologies? Where are the heads to roll? I mean, kahit yun lang eh. I mean, but as you say, lives, it costs lives. From yung depression, from
yeah.
health, from missed cancer cases, missed
Hindi pa natin
people,
na-document yan.
dami pa. Oh. And probably
Yung
they're not
entire,
trying to, not trying to document it.
yeah. Yung from the deaths, sorry, the suicides and all those things that have happened in the past, we have not documented that. We have not documented those things that have, sorry, some
But
more,
it's
the
been
rapes.
documented in the US.
Yeah. There are
So may
cases
evidence
also
naman.
of pandemic rapes in households that have not been documented, you know.
Yeah, I
Uh,
understand.
so there's so many things. Anyway, Doc Iggy, we have so little time. I hope we had more, like 3 more hours now. But given our last 5 minutes, what would you want to tell our viewers? I mean, I understand now. Now I realize that there's so much more responsibility that government and even the local government units and everybody, the stakeholders, there's so much moral responsibility given the deaths that have happened. also because of non-prevention of key conditions, no, like diabetes, lung cancer, stuff like this. So what can you tell the public, our viewers right now on Para sa Bayan?
Let's be more aware of these things. We have to study it. Listen to independent doctors who are not who have no conflicts of interest. There are doctors out there who, and there are real experts out there as well. But the part na no conflict of interest is hard to find.
Mhm.
Therefore, in the end, you will have to do your own research as well to find the truth. In science, ganun
Yeah.
talaga, it's always a constant thing. Public health, however, we have damaged public health trust.
Mhm.
And our government, I think, needs to do something drastic to correct this public health trust issue.
Mhm.
I don't think a simple apology by saying, "I we didn't know," because unfortunately, many Filipinos knew that there was something
Mhm.
wrong.
Yeah.
So I think public health needs to be fixed first for trust, um, and I think leadership. Leadership, unfortunately, is dictated by our politicians, and I hope they have the heart, the the morality, the vision to see that there is a better way. Enriching oneself, your family, your friends, it's not at all the best way. It's one of those things that we should fight. I know people simply call it corruption, but
Yeah.
on a deeper level, it's really a leadership role of our politicians. And yes, of course, the head of the state is above it all. And kasabihan nga, di ba, pag bulok ang ulo ng isda, mabubulok yung buong isda.
Mhm. Yeah.
I mean, we did our best to try to talk to Duterte, but along the way, we were always being hampered by people, by his cordon sanitaire.
Yeah. Those who have the interests. Well,
Yes,
anyway,
absolutely.
Iggy, thank you so much for joining us on Para sa Bayan. It was really very enlightening for me and for our audiences. Hopefully, we can have other fora that we can invite you. There's so much to discuss. There's so much moral responsibility that's been taken for granted in these issues. Well, ladies and gentlemen, we'd like to thank, of course, our special guest tonight, Dr. Benigno Iggy Agbayani of the Concerned Doctors and Citizens of the Philippines. And hopefully, there will be other venues. Ladies and gentlemen, also, we'd like to thank Jason Isaac of Cafeteria Studio for our photos, and also Elise Estrada of Eli Laura Therapy for helping us out in this show. So, Doc Iggy, thank you so much. Hope to see you soon, ha? Baka pwede mag-volunteer dyan sa CDC.
Yeah, yeah. We are
Sige,
all
let us know.
volunteers. We are
Okay.
volunteers.
Thank you.
I didn't even create it. I didn't even volunteer. I was sort of forced into it.
Sige. I
Accidental
think
lang.
there's a siguro may Facebook page.
Yeah, pero it's always
Sige,
shadow
sige.
ban. There's a Facebook page, shadow ban.
Okay. We'll ano we'll we'll join. We'll find a way to get some more people to join in. Anyway, Iggy, thank you so much for joining us.
Thank you, Insan.
Everybody would like Thank you, thank you. We'd like to thank all the viewers also for watching us tonight. Watch the replay, and hopefully we can the discussion snowballs into something bigger so we can help our country. This is Nato
Marami
Agbayani
pa.
para sa Bayan. Yes, on
Marami
the
pa.
new
Hindi ko
channel.
pa sinasabi.
Oo nga eh, kulang na kulang oras. Okay, Doc Iggy, thank you. Good night, everyone. God bless you all. Thank you for watching our show. Thank you. Bye-bye. Thanks, Direk.